Welcome back to Public Health in Real Life. I'm Ashwin Kadambi, Senior Global Public Health Professional. On this show, we bring to you heroes in public health who dare to go above and beyond in their careers to make a significant public health impact in the society. I'm really pleased today to have a conversation with Dr. Priya Patel about leadership and importance of mentorship in public health.
With us today is Dr. Priya Patel. She's the Regional Director of Pharmacy at Baylor Scott and White Health. She's a passionate leader who has enjoyed her 12 years in management. She completed her doctorate of pharmacy at St. Louis College of Pharmacy. Through her mentors, she realized leadership is the path to take and joined Cardinal Health's Leadership Fellowship program in Chicago. From there, she consulted in leadership with Cardinal Health, drove Genova Health's pharmacy and lab space, and landed at Baylor Scott and White Health. Her motivation to drive every day is for her leaders and employees. Dr. Patel serves as a speaker for various organizations and an executive coach. Her success is defined by fostering individuals to take their potential to an entire new level. And what's new? She's the co-founder of the World Pharmacy Organization, where they connect, inspire, and collaborate to change the pharmacy narrative globally. With no further ado, let's welcome Dr. Priya Patel.
Oh,
Priya, it's a thrill to have you on the show.
thank you so much. That was a lovely introduction. I really appreciate that.
Absolutely, absolutely. So, you're from Texas, and a few weeks ago, Texas faced with a public health crisis in addition to the ongoing battle against the pandemic. I'm talking about the winter storms. And health professionals at local, national, and international levels are being pulled into leadership and management roles. Yet they don't get the leadership training required to either lead through crises or lead people. As a pharmacist leader, why do you think it's important to lead? And what do you hope to accomplish from leading? And why is it important to include leadership training for health professionals?
Yeah, that's an excellent question, Ashwin. I will say that, with the pandemic and the recent, there's been so many things going on in our metroplex, in our state, in our nation. I think leadership is really important, especially in healthcare, because when we go to school, first of all, I'll just start by saying this. When I went to pharmacy school, or you go to medical school, or you go to nursing school, there's a lot of times that you're not necessarily you're not focused on training from a leadership standpoint. So it's very tactical. There's few courses that they provide in a finance standpoint, from a statistics standpoint. But for me, I realized that there's actually a lack of leadership training in our entire industry. Why is it important? Well, I think the number one thing that we do as leaders is we're advocates. We are advocates for our employees. We're advocates for our systems, for all kinds of different avenues. And so it's really important to actually sit down and say, we need to have someone there to really push the voice for our different various employees or professionals. And in doing so, I think, I've realized that leadership training is really important, because I myself was very lucky to receive leadership training through my fellowship, but really through my mentors. They believed in me. They gave me those opportunities. So I think in order to drive some of these issues that we have at hand, it requires somebody that's going to speak up and support our professionals to take whatever their issues or challenges are to that next level. And we really saw that, during this pandemic, that it is really important for us to step up, not from just a support standpoint, but to really push the voice. I mean, I keep saying that because I believe in that. It's really important to say, an employee comes up to you, they're having these challenges, let's say in the workspace in healthcare. And one of the things that I think we've often relied on is, well, the system or the organization will handle that. That's actually not true. It's our responsibility as leaders to bring that up. So that's where I'm at with leadership and training.
Yeah, that makes sense because we are who represent the organizations, and as you're speaking, I noticed that unique situations call for unique leadership styles. So, are there different leadership models within public health?
Yes, there's different leadership models within public health. I think some of the leadership models, and I think there's transformational, servanthood, transactional. There's all these different types of models that exist out there. I think that the models that it's our responsibility, and I think we have to get away. I'll be honest. This is my opinion. I think we go to get. So I went and got my MBA. And there's very theoretical methodologies of how you can actually lead in your workspace, right? So what I've realized is we need to move away from that. We need to move away from the theoretical, this is what was written in my book and this is how I'm gonna lead. We've got to move into a customized leadership model where you've got to understand who your employees are or who are your professionals, and try to figure out how am I going to cater some leadership opportunities. So I think for me right now, I think all three different types of leadership models really fit. Again, it goes back to the employee or the professional, what works for them, right? Because you do have transformational model. I think that's really where we need to be, where we're taking it and really embedding the vision and the mission of the organization, of healthcare in general. We've all taken an oath, like I've taken an oath as a pharmacist, right, to be the best pharmacist I can be, but taking that and the vision and mission and combining it and really providing those resources for your leaders, I think it goes back to what does that employee professional really need, and it's a customized approach.
And you talked about the three models, so you said transactional, you said transformational model, and the other two are like transactional and servant. And in terms of like young people, young professionals, which one do you recommend for young people, or would you? Because there's two methods, you see. One is taking the permission and doing. The other one is, you do it and then you say sorry rather than you ask for permission. Which model would you recommend for young professionals?
So that's an excellent question. Really good question. So I'm going to have to think about that because so depending on your personality and who you are, it depends on what you're trying to do. So if you're trying to be innovative and outside of the box thinking, sometimes those employees are not going to ask, or those professionals are not going to ask for permission. That's okay. But also, I like to say you have to it's important to take risk. But when you take risks, make sure that you understand the consequences that come with it, right? And so for young professionals, I say this, we are in a highly regulated industry, healthcare. I mean, there's a lot of red tape. There's a lot of things that we have to kind of really look at from a risk standpoint, because patient safety is number one for us, right? So when we think about those things, as a young professional, when you decide to take, let's say, for example, I'm going to ask for forgiveness later, realize that there could be some consequences. In that situation, I say you lean on your mentor. That's a perfect prime opportunity to lean on your mentor. For me, in general, for young professionals, I think it's just really important to drive as much as you can drive. There's a paradigm shift, right? We're going away from the traditional style of leadership, the traditional style of, all these, there's a chain of command. And I think in corporations that exist, there's reasons for that. And most of it's because of patient safety is number one, and quality. But as we move into this paradigm shift where we've got the Googles and the Amazons and all of those industries out there that are competing, we've got to take a step back and say, in order for us to be innovative, you have to really promote your young professionals to take it to that next level and really allow them to drive without constantly being, I hate using the word micromanaging, but I think that's really what comes to my mind. So again, to reiterate, take risk. I think it's important to take risks, understand what those risks could lead to, and understand the consequences. If you're unsure and you're worried, ask your mentor, ask someone that you can rely on.
Well said, Priya. So in terms of, I'm curious, so how do you approach starting a project, proving its concept and scaling? Young professionals usually struggle with this.
Yeah, that's a good question. So starting a project, so again, it goes back to different personalities. I have a different personality where I like to ensure that we're including all key stakeholders into that project. So for example, if there's a discussion on, hey, we need to look at implementing a new service line in our organization, the first thing that you really need to do is make sure that you have your key stakeholders there. From there, you've got to really sit down and explain what is the vision of this project. What is your why? Because young professionals, especially in these different generations, want to understand what is the impact that they have by driving this project. Once they figure out the why part of it, you'll start seeing a lot of those sparks flying, and you'll see, okay, I want to do this. This is where I want to go. This is the next level that we want to get to. So once you start having that, I think the way that I see a lot of young professionals is you also have to have somebody that's really going to be organized and be able to kind of keep a nice, okay, so let's talk about our process. What are we going to do first? What are the next steps that we want to take? So kind of have that available. And then from there, I think when we look at young professionals of how to kind of end the project or get to that final result, it's really important to really continue to give them the feedback of, okay, this outcome looks really good. Let's talk about the various outcomes based on the different types of solutions we're putting together. Does this outcome, number one, meet the mission and vision of whatever organization or healthcare process or initiative you're trying to meet? And number two, do we feel like it's a long-lasting something that has least risk for failure? So those are the things that we talk about. But ultimately, I say to young professionals, it's not always about if there's success or failure in the project. It's about what did you learn from that project? Because I've learned I've had 12 years of leadership experience. And in my 12 years, the one thing I've realized is you learn from the project, which makes you better, faster, and stronger. So it's always important to go back and say, what did I learn from that? What am I going to do differently? Or what am I going to keep the same that worked from that project?
So awesome. So actually, you touched upon learning a lot, and from the conversation, I'm learning that leadership entails a lot of creativity and imagination, not only in designing solutions but also implementing solutions. And leading today requires the transdisciplinary learning, and to design sustainable solutions. So can you give us some tips on learning skills young professionals should develop to be successful leaders?
Yeah, so I think we're in the world now is we want instant results. Okay, so I myself struggle with it, so I have to share this. You have automation, you have technology, and I think those are things that drive instant results. I talk about this because when there's a lot of young professionals, and I can talk about my own journey, I was expecting if I put all these processes in place, I should have results just like that. And what I realized is patience is probably the number one skill set that I would recommend from leaders. So I think that's one thing for sure, because when we think we go into leadership, a lot of young professionals go into leadership because they are wanting to drive change in their industry. And I commend them for that. That is what we don't have enough people like that. So we want to continue to foster that type of motivation and desire. So number one, I would say patience, because of the world we live in. The second thing I would say is, I always say, you don't have to have the technical skill set. You don't have to have experience, but as long as you have the motivation and desire to learn, you will be a successful leader. So there's humility that really comes with leadership skills, especially when we talk about young professionals. It doesn't matter how old you are, how many years of experience. Humility is very, very important, because humility not only allows you to learn from skilled leaders, but it also allows you to take a step back and learn from your employees. Because at the end of the day, they're the ones that are boots on the ground dealing with the day-to-day issue. And if you don't have humility, you're going to struggle to connect with them from an empathy and sympathy standpoint. So I would say humility is probably the second or third. And then emotional intelligence obviously kind of loops into that. I think what I've realized, the smarter you are, the less we focus on emotional intelligence. And as a result, I think through years and years of training and experience, emotional intelligence is very important to drive change and to really connect with human beings. Because at the end of the day, I go back to this, I stand by this. We are healthcare leaders. We are leading people who impact other people. This is not Toyota. This is not a manufacturing industry. We can't say, let's produce faster parts. We have to say, let's produce better quality and better outcomes for our patients. So emotional intelligence. And then finally, there's, the basic key principles of management, of, making sure that when you lead, you have to understand change management. You have to understand how you're going to impact employees and individuals. And I think those key principles that we could go on and on about, those are really very important. So to kind of just summarize, I would say for young professionals who are going into leadership or who are wanting to go into leadership, I would say the number one thing is it's important to understand the base key principles of management, whether it's Stephen Covey, or any of those kind of like basic principles, but then also build on that by taking yourself and saying, I want to refine my subjective, because objectively, I think healthcare leaders are wonderful. I mean, there's going to be some business things and things like that. Subjectively, though, I will say that I've learned that through time, it takes time, patience, humility, and emotional intelligence to gain those skill sets.
Perfectly said. And I actually struggle with that myself, and as I develop myself. And see, in terms of, if we look at the public health world, we have our own technical field. Then we have literature coming out of our own technical field. Then literature from leadership and management. Mm-hmm. Then literature about the future of our field. And then we have our own daily work, 9-to-5 work. So how do you kind of manage that kind of a learning curriculum on the go while not being overwhelmed?
That's a really good question, because I myself am trying to figure out what is the right way to do that. I'll be honest. I think there's a Harvard Business Reviews that I think a lot of us focus on, and I think those are really good. But I've realized that so I have a team of leaders that I work with every day. And what I realize is if I send them an article, they're not going to read it. So what's important is I've realized podcasts are really important. They're really easy to kind of to learn, and like like I mentioned earlier, I'm in the Austin Metroplex, so most of my drives to different hospitals are over an hour long sometimes. So on the go, I'll listen to whether it's a podcast. I love listening to YouTube like yourself, like this. The public health in real life is really, really exciting because I get to listen to different leaders and drivers in the industry to kind of learn what works for them. So YouTube is really important. And then LinkedIn, I go back to LinkedIn. When I teach to our students at the pharmacy school here locally, one of the things I keep seeing is there's a plethora of information on LinkedIn that you can constantly interact with too. So it's important to prevent overwhelming yourself. Number one, just remember this. You have to give yourself a break too, because I think one of the things as leaders we try to do is we try to find solutions for everything, because that's just how we're built. So when we try to find solutions, we're always looking for, okay, what's that literature? What's this? What's that? But you have to give your brain a break. So sometimes it's not good to listen to literature or podcasts all the time. But if you have, I would say, so during the downtime, try to find a podcast or something to listen to that really that creates a shift in your mindset, right? So it could be something that you're passionate outside of work, whether it's fitness or dance or whatever it is, right? So try to do that and then come back to trying to understand, gain some leadership skills, because your brain needs to kind of take that break to really refresh. And also listening to things that are outside of leadership that are kind of goal oriented too, whether for me, it's fitness. I've realized that it really starts using different parts of your brain that allows you to kind of think outside of the box and add creativity into your mix. So that's kind of what I like to do. But for me, podcasts are huge. YouTube, these type of avenues that you guys have is been really, really helpful.
Thank you so much. That was helpful. And in terms of one important area within leadership is decision making, and and in public health especially, we have to make decisions under complex environments and and we have to take into consideration interests of different special groups involved. So have you had any experience, or could you share an experience with us where you have dealt such an experience where you had to make a decision under a complex environment?
Yeah, so I laugh because I feel like that's every day. I feel like leaders in this environment, especially with the pandemic and, we've had a lot of costs. I would say it goes back to finances and leadership. And I think the dynamics in a large corporation or a large hospital system can be difficult sometimes because you're not necessarily navigating what is going on. So for example, if you're in a health system, a lot of times the leadership is not local, right? And I've seen that kind of, it doesn't have to be just my health system, but it could be anything, CVS or, whatever it may be. So when you look at that, the decisions you have to make sometimes impacts not only just a specific, so if you're trying to impact a specific location, you have to realize that decision could also impact a whole different geography that may not be yours. So let's say specifically, let's say we want to drive, I keep going back to a new service line. We want to open a new service line. And what you realize, in pharmacy, for example, medication reconciliation, that's a service line that a lot of physicians want to really help ensure that we know what their medications are. So you might be able to drive that, but there's challenges that come with, you've got the financials you have to hit. You have to make sure that, if you're in a system, how do you actually standardize that across the various hospitals that are in your system? Because as soon as one hospital hears that, you're going to get that. There's going to be physicians in a different hospital in the same system that say, well, I want that service too. So, those are the kind of decision makings you have to make. And I would say when you have to make decisions in a complex environment, and we have to do that every day, because at the end of the day, you've got patient care, quality, patient safety. You've got how does that impact your employees? How does that impact your operations and your bottom line, right? Those are the things that you look at on a day-to-day basis. You have to really sit down and realize that in a complex environment, it's very important to have communication as your number one driver. You can come up with a solution, but at the end of the day, if you have not talked to every single party that will impact, the chances for success for that decision or solution is going to be slim to none. And I know it's exhausting sometimes. I think that's the number one people will say in a complex environment. It's exhausting. It's exhausting that I have to have 30 conversations. And after those 30 conversations, we sometimes go back to the start, and we basically have to redo the entire discussion. What you as a leader have to realize is, again, it goes back to what I said before. It's what did you learn from those 30 conversations? What is the trust that you've built in those 30 conversations? And when you start over and go again, you're going to be probably able to accomplish it faster, but with higher efficacy. And so, again, I know I've kind of gone into different areas here, but in a complex decision-making environment, the number one thing that I would say is communication, communication, communication.
Yeah, that's absolutely. I mean, we see a lot of problems because of miscommunication, under communication, and or also putting words in a different way, and kind of misinterpretation of information, I would say. So in terms of like when leading a team and um, leading a set of team or set of people, sorry, with under common goal, how do you kind of differentiate between having authority versus having an influence on the team?
Yeah, so that's something I think that comes with experience, 100%. When we look at authoritative versus influential leadership, those are two very different avenues. And I think, when we look at how we want to move, you have both. I can't say one or the other is right or wrong, but I will say there's a time and place for both of those things. Authoritative leadership, in my opinion, is I feel like it's a little outdated. I don't think we really want to, like I said, that's something that's not going to help drive. I would say, like in the baby boomer generation, that was very prominent to have authoritative leadership. Now, as we move into a different era, like I said, immediate technology and automation and competitive, right? A market competitive analysis, we look at that and we say, at the end of the day, you want to be a company that's driving leadership through influence. And that is very tough. Driving leadership through influence means a lot of different things. It could mean that you are not maybe a direct, manager or supervisor over those employees, and you have a dotted line to those employees, and you have to be able to help them understand the bottom line goal for whatever you're trying to accomplish. And I would say, when you're trying to work with influential leadership, and you can even do this, in your day-to-day, the influential leadership is making sure you go back to kind of those soft skills that I talked about: humility, emotional intelligence, connection, really sitting down and trying to understand what makes that employee tick, what makes them motivated. Because at the end of the day, not one size fits all, right? We hear that all the time. And so if I talk to employee A and their motivation is, I really like patient safety, I really like working on the quality things, but you put them in an operational situation, you're not going to get the results you want. So part of influential leadership is saying, okay, you are very gifted in this area of patient safety and quality. Let's try to find a fit for you that makes you, excited to come to work every day. But at the same time, you're helping us drive quality in that area. And so I think part of influential leadership is really trying to understand what drives that employee. Now let's go back to authoritative leadership. In that same situation, employee A that likes to drive patient safety and quality, if you put them in an operational situation, you're not going to get the results, right? Because they're going to hate their job. They're not going to enjoy what they want to do. But authoritative leadership could be, and I'm not saying this is all like this, it could be, hey, I need you to get this job done because this is what we need. So it needs to happen. Otherwise, I'm going to write you up, right? And I think that there's a time and place for both things. But I would say with authoritative leadership, you have to realize that authority, and by definition, means that you have the power to kind of make decisions and drive decisions based on your title and what you're able to do. You still have the authority, but if you move into more of an influential mindset, you sometimes may have to tell employee A to go into operations. Because guess what? As we saw with the pandemic, as we saw with a lot of health systems, surgery cases were decreased, right? We lost a lot of revenue in a lot of our healthcare systems. We had to go to a model. We had to make a decision that let's try to really make sure we focus on just making sure that we have our operations completed so the patient's taken care of. Anything higher level, sometimes we couldn't get to, right? And so with influential leadership, you can still get somebody like employee A to help in operations. But it's, again, connecting with them and saying, I know you like patient safety. I know you really like quality. So what I like, but here's my situation. I really have to make sure that we get these things done. If we can get these things done, I want to get you to a better place where you can start doing that. Is that something you can help me with? And that's the type of things that we need to drive in influential leadership. Again, move away from the authoritative mindset, because at the end of the day, the new generations, young professionals, want to be part of the solution, and they want to feel like they can make an impact. If you can't do that through authoritative leadership, you will not you will not motivate them. You will actually make them shy away from what they want to do, and often lose those employees to a competitor, for example, like the new tech industries that really do have that type of mindset. So that's kind of where I stand with the two.
Thank you, Priya, because this is a serious issue, especially in medical schools. When students work under a resident faculty, they complain a lot about burnout and bad experiences with their higher officials, kind of being an impediment to their growth and success and development. And even we see this for PhD and graduate students as well. The role, the importance of leadership and those skills that you spoke about for people in that position, and its importance as we move, as young professionals become those professionals over time, to embody those skills that you spoke about, whether it's humility or emotional intelligence. So let me shift the conversation a little bit. I think you spoke a little bit about mentorship, but why should anyone have a mentor? You can start from there.
Yes. Well, there's so many reasons. There's so many reasons about why you should have mentorship. So I will start by saying this. When I went into a profession, right, healthcare, where my parents are not healthcare professions. They're in the engineering and computer programming industry. So that's completely different than what I do. So a lot of times we are going into an area where sometimes we don't have someone to kind of have conversations. So let's say, for example, you work at a location. Mentors will allow you to have conversations that are honest without judgment and provide support that your boss or your manager or whatever, your supervisor may not be able to have. And I have realized that through mentorship, one, I get honest feedback. So sometimes when I feel like, oh, this isn't working well, or this, I'm trying to drive a solution, a lot of times they'll give me feedback. Well, Priya, like, you need to take a step back, because you need to think about what is your organization trying to accomplish, or what is that, whatever it may be, what are they trying to really accomplish? And so it kind of gives you that real-time feedback. And it's someone that actually is very invested in you. So mentors are different than the people that you report to at work. It's a little bit different. Your leaders at work are invested in you, but a mentor has a genuine investment in you because they actually have some sort of connection, affinity towards you, right? So I have several mentors. I had a mentor when I was about 14 years old. I worked in a hospital and I volunteered, and I knew I wanted to go into healthcare. That mentor, to this day, it's been about 20 plus years. He's the reason why I'm in the hospital system I'm in. And I've kept in touch with him. And what I realize about him, or, any of my other mentors, I've got mentors through different parts of your life. You're going to have mentors. And the difference, again, mentors you talk to offline, you talk to help and invest in you, and really take that time to say, I'm really struggling right now. I'm really in a spot where, I don't know if I'm doing something, I need to change what my decision making, or is it something where there is actually a problem. Mentors will provide you that real time. Most of the time it's unbiased, but there can be some bias, right? Because they actually are invested in you, and they're going to give you feedback and solutions that sometimes you don't want to hear. And I feel like that is the type of relationship that you need outside of work to really kind of fall back on when things are maybe difficult or challenging at times. So again, I value my mentors. I have many mentors, and I know that depending on the situation, I want to talk to a specific mentor because I feel like they can relate or understand that situation. So the value of mentorship is huge. You can look at every leader out there. The most successful leaders probably have many, many mentors.
Sure. So how do you select a mentor?
Yeah, that's a good one. So what I've realized is mentorship. Okay, so first of all, whenever you interact with somebody, you have to be able to have a very easy conversation. So if you're intimidated by that person, or you feel like, like I can't have that conversation with them, that's probably not the right mentor. So number one, probably find someone that you can relate to. And it doesn't even have to be in the same industry. It could be, somebody in, I could talk to somebody in the fashion industry. And I know that, that person is going to give me some advice from a subjective standpoint, right? So we talked about the soft skill set. So the first thing is, can you relate to the person? The second thing is, when you look for a mentor, you want to kind of figure out, do they have the time to really sit down with you? Because a lot of times we have this idea of, this person would be a fabulous mentor because they would be able to provide XYZ skill set to me, right? From a selfish standpoint, you might say, like, this person would be really, really great for what I'm looking for. But if they don't have the time, you're not going to get what you need out of that person. So I would say the second thing is, do they have the time? And then lastly, with mentors, you want to look for someone that's really going to be able to have an honest conversation with you. And what I mean by that is going back to, for example, I might call my mentor, I'm really struggling with this, and, I feel like, I'm not getting the feedback or the help that I need. So the main thing is getting someone to say, well, hold on a second. Are you sure that it's really your organization? Or I know you've got these things going on from your personal life. Is that what's really bothering you? And if you can have an honest conversation both ways, that's going to be a really good mentor. So again, the first thing, relate. Second thing, can you have do they have the time for it? And the lastly, it's, can you have an honest conversation where you are able to receive the truth? So that's where you're really comfortable with them.
Yeah, and we see a lot of advertisement nowadays about career coaches.
Yes.
And so should we go with a career coach or a mentor or both? Or what is your recommendation around that?
So those are two different things in my opinion, right? So you've got a mentor that's going to give you kind of like that unsolicited advice, right? Like they're going to tell you like it is. They're going to help you because they care about you. They're genuinely interested in you. A career coach is you're paying them to drive results, right? So your mentor is not going to necessarily drive results for you. They're going to give you that kind of like kind of like something that you can bounce off of ideas and have those conversations. A career coach is really going to say, okay, Priya, I want to talk to you about your goals. Where do you want to be in, 5, 10, 15 years? Okay, so in order to do that, you need to get this certification. You need to do this, X, Y, Z. And then they're going to come back and hold you accountable. So those are kind of the differences between the two. I personally do not have a career coach. However, I'm getting to that point. I think, as you start kind of growing and you're wanting to go into a higher level, more strategic type of role, it's probably a good idea to start getting a career coach. I would say for young professionals, a career coach would be really helpful when you're trying to think about how am I going to I'm having these issues with maybe connecting with my employees or creating impact. Having a career coach allows you to really have that time on a scheduled basis to really work on that skill set. A mentor, like I said, will help you. I know that I mentioned that do they have the time for you, but mentors are not going to sit with you necessarily every week or every 2 days or whatever you're trying to accomplish. So that's kind of the difference I would say. For young professionals, I would say a career coach is helpful, but you don't need an executive coach maybe at that time. But as you get into more higher level roles, an executive coach is going to push you a little bit differently. Your mentors are there, but I think it's time to really look at an executive coach or whatever it may be to kind of take you to that next level.
Thank you. You actually clearly distinguished between career coach and a mentorship, and really is that different points in the career you select which one you need to have to get to that next level. So in terms of could you talk to us a little bit about your childhood experiences and what shaped you into the person you have become today?
That's a really good question. I don't get that question a lot. So on Clubhouse, we actually had this conversation come up because a lot of parents are asking, how do I get my child to that next level? And I want them to be a leader, and I can tell. I will say my childhood experiences were wonderful. I had parents that were really invested in driving success for me. Although at that time I thought it was, oh my gosh, I don't want to do all of these things, but I realized those are the things that have shaped me today. When I was in elementary school, really in middle school, my dad and I really would sit down. I remember like sitting on the couch and really talking about what is my 10-year plan. And at that time, no one was doing that. And it would be like, okay, if you want to go to, let's say, like, as an Indian person, right? It was a medical professional that was really exciting for them too. So they would talk to me about it. And so I said, I don't know what I want to do. So, we would have those two-way conversations and say, do I want to be a dentist? Do I want to go into medicine? Do I want to go into pharmacy? So what we did is we would look at, the different various schools and work backwards and say, to get to that point, how do we get there? So my parents were very invested in my education, but also doing the research to figure out how I can be successful in that industry. And I think that's really important to drive kind of like those experiences and really to say, okay, do the research. So I always tell people that, for kids especially, and for my childhood experiences, my parents kind of helping me with doing the research, but they didn't do everything for me. A lot of times they would say, these are the things that we need to do. Now, how are you going to accomplish that? What are you going to do? So a lot of times I would say, well, I don't know what career I wanted to do. So in my childhood, I remember in high school, I went up to my my teacher and I said, I would like to create my own course. And they said, okay, you want to create your own course? And I was like, I do. And I was like, in this course, I want you to give me a little bit of freedom. This is what I'm asking for. I'm asking, can I go shadow a dentist for 4 weeks? Can I shadow a pharmacist for 4 weeks? And can I shadow a physician for 4 weeks? They're like, okay, but we've got to have some outcomes. I was like, no problem. I'll create a presentation for each of those 4 different industries and then talk about how it impacts me and all those things. So I created my own curriculum. And what I realized is that you have the power really to change and make impact in this world. If you don't ask, you will never know. So I did that. And then my parents allowed me to kind of help me drive success in the sense that I graduated from high school at 16. And I graduated, they took me on a college tour. I got into pharmacy school in 11th grade. I didn't even apply. But that happened because of all of the kind of the work that I've done in the past. So my childhood experiences, I've been very lucky. I've been very blessed. And my parents were my mentors and they really guided me. But they always pushed me to do things that were a little uncomfortable. I would go to colleges and I would lecture on, I'm very, very involved in dance. Especially in our Indian culture, like Kathak and Bharatanatyam. And so I would go and lecture at world history courses in colleges. So they pushed me to go speak in front of 200-300 people, whether it was even for a Thanksgiving celebration at a local church even. And they would say, I want you to go talk about what Thanksgiving means to you. So these are the childhood experiences that I had. And because of that, I've been very comfortable with being in the uncomfortable situation. And I would say that's where I'm at today.
That's really awesome, Priya. This is quite inspiring to me, and I am sure to the audience as well. And I believe that even though parents might not be an inspiration, still that's where the mentors can come in and
Yes.
can be that inspiring role models. And the even platforms like this, for me especially, it was a bit intimidating to approach you as well for this interview. So, but I believe it's about going forward and approaching, whether it is mentors in your life or
Yes.
people with whom you need to interact to get to that next level. So that was really good childhood experience. Thanks for sharing that. And in terms of who is your favorite leader?
I know that a lot of people ask me who's my favorite leader, and I would say I think every single person that I'm around, I take the good in that person. I'm not, when people say, are you looking at a famous person? Who's your favorite leader? If you look at all these different kind of like celebrity-esque, you have in public health or in, whatever it may be. For me, it's who impacts me in a positive way. It's every day I feel like that is a positive and impactful leader to me. And I know probably the answer would be more of a specific person, but it's not. It's every day when I look at somebody that has inspired me and pushed me to another level, I take what they're really good at and try to understand them on a day-to-day basis. I will say that, having a new vice president, for example, Kamala Harris, and, we have, I always go back to the Pepsi company, leader and, all the different leaders that are out there. It's, for me specifically, it's really important to look at someone I feel kind of I can relate to. So someone, whether it's a female or someone with minority background, those leaders to me are probably the most impactful because I think I can relate to some of the challenges that they've gone through. And going back to what I said, it is really important to look at those leaders, but to look at them with a grain of salt, because at the end of the day, they have a different situation, different scenario, and what they're going through, what they're dealing with, is not the same thing that you're going through. What you're going to be dealing with. So when you look at those two things, I say, sure, you can look at your favorite leader, but also look at the leaders that are surrounding you every day. And they may not have titles that we're thinking traditionally, like a CEO or a VP or whatever it may be. It could even be someone like in your house that is a leader for your family. It could be a leader for an organization. So to me, every single one of those individuals impact me in a positive way. And I mean, I look at the positive in every single person. That's how I operate, and that's what drives me.
Okay. When you said the word positive, what is the role of positive psychology in leadership?
My goodness, that is a hard thing to do. I will say from personal experience, it's very difficult to do, but the impact that it has on your employee is just surreal. You can go into a environment and you can say, I'm going to go in and I'm going to talk to these employees and say, you're going through a tough time. And you can say, oh my gosh, we have this initiative. It's going to require a lot of work, but the outcomes are going to be XYZ, everything that you guys have really been looking for. You're going to change the mindset of those employees, and they're going to say, yeah, I want to do this. This is exciting for me. And the positive aspect of leadership allows you to really program and encourage kind of thinking to new levels. I think the one thing about positivity that I've noticed with every single leader, when they bring positivity to the workplace, you'll know that the results are attainable. Sometimes the impossible is very possible. And I think that's because when you're able to encourage and inspire and drive, that we are able to do this. And if this doesn't happen today, look at all the good things that I haven't. I go back to that first example that I talked about, project management. It's okay if you don't hit the results. At the end of the day, talk about all the great things that you have really kind of accumulated throughout the way. We were able to find data reports that we weren't able to find. We were able to drive this different change. We created a relationship with that physician that wasn't agreeing with some of these initiatives. Those are the things that you can do. And when you take that back and kind of reiterate those things, you're going to see employees that are going to take your entire organization to another level. So positivity is very important. I thrive off of that. Personally speaking, leaders also need to have positivity and inspiration. I think it's important that, I'll go back to saying this. Positivity is not only about giving it to your staff, it's also about taking it in. So for an example, if you have a jug full of lemonade and you give everybody some lemonade, at the end of the day, if you don't have enough to feed yourself, then you can't take care of your staff. You can't take care of, driving change. So it's important to find your own ways to kind of absorb that positivity. And for me, when you ask me about leaders, famous leaders or people that kind of have a motivational video, that's the type of stuff that I do to really kind of reignite my motivation and my soul to keep driving. So I just wanted to make sure that leaders also need positivity too.
Sure, absolutely. And actually, I hope project management professionals who are watching this video are a bit more lenient in the future after thinking positively about all these other aspects that go into a project, not just those deliverables. So we have two audience questions. Let me start with one. So it's an interesting topic, and Dr. Priya's articulate. My question is, many times the mentor or leader is not happy if you're over smart or intelligent and cut your progress. How do you this is a real kind of complaint I've heard from young professionals. So how did you deal with this?
Yeah, so if you're over smart, there's this book that I read. It's called Your First 90 Days. I don't know if you've read that book. So I recommend that for anyone who is going into a new job or a role. And in the book, they talk about it. And they say, when you go in and you say, oh, I know this, I know that. Or, at my last organization, we did this. So this is a very good question. And so one of the things you have to realize in that relationship is humility. So that goes back to kind of like what we talked about before, is you have to take a step back and say, what is the mentor trying to say? You may know those things, but there's something that's not working, right? That's why you're reaching out to your mentor sometimes. Something that's not working and why you're reaching out. To take a step back and say, why isn't that working? And I think that when we know, I think as individuals, when you're reaching out to a mentor, you're already really smart. I can tell you that. Most people that are reaching out to a mentor, they're very intelligent, they're brilliant. And I think that goes back to understanding your emotional intelligence. So what I would say in those situations is probably having a conversation and say, hey, so this is my personality. The way sometimes I say things is that I will, kind of go into a discussion, kind of know these things. How would you like to communicate? Because I want to make sure that I'm respectful of what you're trying to say. And I know that sounds very basic, but as long as you kind of set like the base and kind of like the tone of the conversation, your mentor can understand you a little bit and they can understand, and you can understand them. So again, it goes back to try to sit down and have that conversation along the lines of, hey, this is the way I communicate. Does that work for you? And if they're like, well, when I'm going over examples or whatever, I want to make sure that I feel like I'm impacting you, and you'll have that two-way conversation. So I know that's very basic, but I would really have that conversation with the mentor so that way you set expectations.
Thank you. That's helpful. We have one more audience question. Do you have any suggestions to encourage established public health professionals to become mentors themselves? Would an organizational level vision or structural changes help with this? I'm thinking this is more of terms of this is a topic that I also came across, whether mentorship must be like implemented or from an organization, or should it be like more of a private thing you do?
Yeah, so that's a good question because, and I mean that has I'm thinking about a lot of things in that question because there's a loaded question. It's a good one. So what I would say is this, like, it is encouraged. So for example, for myself, I am a mentor myself, right? And I'm a mentor because I know that at the end of the day, that's what brings me excitement and happiness. And I know that it's been very valuable to me.
Sure.
You can find mentors within your organization. I would say that that's fine. But I would really, really try, if you're going to mentor, you would probably want to go outside of your organization really to find mentorship. If you want to serve as a mentors, what I would say is this. I would say, number one, students are probably the first place you want to go and help. I know that sounds kind of like, you're like, I want to help at a higher level. It's true. But I would say that's where I've noticed that students are the ones that are a little bit more, they need more help right now because of the pandemic. They're doing a lot of virtual school, virtual technology. So it's kind of, it's really decreasing that motivation and excitement for them to kind of continue in their industry. So I would say that. And then I'm looking at the second part of it. Would an organizational level vision or structural changes help with this? So if you want to look at mentorship, I would say when you look at like organizational level vision, that would help with it, but it's not about the organization. Mentorship is about connecting with that person. So think about the values that you embody on a day-to-day basis. Is it about, you at the end of the day, are you trying to accomplish leadership to a point where when you talk to somebody and you're helping them, are you able to really sit down and say, let's talk about the connection that you and I have? What are the challenges that you're dealing with? Because at an organizational level, that will be for any person. I have my own organizational vision, but my goal is not to necessarily talk to my mentor about that. My goal is really to talk to a mentor about how do I drive change. Maybe you could talk about the vision, but how do I drive change in the current status quo that I'm dealing with? And I think this is a tough question because a lot of times we want to just we want to mentor based off of what the organization says. that's not necessarily true. We want to be mentoring based off of the quality that you can bring as an individual. And so I don't know if that answers the question, but I mean, I'm happy to kind of expand on that a little bit.
It does. Thank you. Thank you. And in terms of your new adventures, you just started the World Pharmacy Organization. Could you talk about, could you share about what you hope to accomplish from that project?
Yeah, so the World Pharmacy Organization was something that myself and then Wasim Ahmad and Ali Zhu came together. So all of us, we found each other, and we're all pharmacists, different part of the world. And we decided, like, hey, let's talk about what do we want to accomplish? And I think the number one thing that, especially all of us bring different aspects. So the number one thing that I really value is I see disparity in care, and especially in the pharmacy space, I see a lot of disparity between even the way that we work as pharmacists, how we can make an impact in our parts of the world. It's really heartbreaking to see that there's different parts of the world where there's not that relationship between the physician and the pharmacist, for example. So I think part of it, the organization's mission is to kind of close that gap where, UK, Australia, and the United States, we have that conversation with the physicians where we can intervene and have that relationship. At other places, they still don't have that relationship. And then with the pandemic, it's becoming more and more apparent that even though the physicians, for example, are overwhelmed by caring for these patients in different parts of the world, there's still a gap where that pharmacist or the nurse practitioner or the whatever it may be, the physician's assistant can really help that physician come up with treatment options. And that's just an example. So I think that's one part of it. The second part of it is we've realized that artificial intelligence and digital health is going into a whole new level. When we look at that as pharmacists, especially, and this organization is not just focused on pharmacy, even though it has that word in the organization, it's pharmacists working with other people like technology and creatives and thought leaders to come up with where do we need to be driving healthcare from a treatment standpoint. So we're working with a lot of people that are not in the pharmacy space, because as pharmacists, we go to school, we have this is the things that we're supposed to do. But when we get out, a lot of times we're a little lost, and we realize, in order to kind of get to that higher level of thinking, I've got to network or talk to somebody that is not in my industry, right? And so kind of like we talked about with, emotional intelligence or any of those things, that's not something we're taught in school. So World Pharmacy Organization is connecting and networking with other parts of the industry, different industries, to find a way to really drive solutions as we go with artificial intelligence and digital health. And lastly, it's going to be a platform where we're there to serve and help whoever needs help, especially in the healthcare space. So again, we're hearing that there's a lot of opportunities in different organizations and countries, and we want to become a platform to kind of be that go-to and say, hey, I need help with XYZ. We're going to find you those solutions because of the network that we've created. So that's where we're going with World Pharmacy Organization.
It's an excellent initiative, and not only pharmacists, but all people within the healthcare system and beyond can benefit from the initiatives that World Pharmacy Organization is taking. I have listened to a couple of the talks, and I have participated in a couple of initiatives from the World Pharmacy Organizations, and highly recommend. We will provide the link in the description right after this video. And Priya, thank you so much for joining us today. It's been a terrific conversation. We hope we'll have you back sometime in the future to share about what else you're learning and what the future of pharmacy leadership looks like.
Thank you so much. I'm so glad to be here today, and I look forward to our future conversations. You guys are wonderful.
Thank you. Thank you also to our audience for joining us today and for your questions. We will see you next weekend here at Public Health in Real Life.
Thank you so much.
Bye-bye. Thank you.